Welcome back. Curtis Stohr, trainer with Family Investor. Today's subject is Medicare. And this is really important. This is one of the reasons that I wanted to start doing these trainings, is because when I got involved with the healthcare industry, or with some life insurance agents, they were selling health products, which covered supplement products. And I had a big aha where I discovered that a lot of people retirees were having big issues with their current plans, and they couldn't switch or they couldn't change that. So I want to do this training, and I think it's part of our deep dive training, but I'm also going to post it as a blog, because if you know anybody who's 64 or older, or up in their 60s, they need to go to my blog and they need to watch this training. Okay, so let's get into it, and you'll know why. And this is part of your training too. It's something, our trainings are to plant seeds, so later on when we get into the advanced trainings or the big picture training, you understand why we do what we do, because everything fits together. Even though not everybody's path is the same to wealth and protecting your wealth, they'll be similar. And if you know what your choices are, you know what your options are, you could take your own path to the end. Let's see. Let me get over into the training here. We get started with there we go. Covering the different parts of Medicare. They call it Medicare Part A, which is basically your hospital insurance, covers the building and services within that building and everything, blah, blah, blah. I give each one of these my own little label. And the reason I do that is so it might help you remember also as you go through the training and afterwards. And as I said earlier, what I discovered when I got involved with the insurance industry, I learned all the pitfalls that people have encountered later on in life. So I found that this, even though I don't sell this, but I think it's a really important, and my trainings aren't to sell you anything. It's to give you guidance to make the right choices. I'm a real estate investor. I'm not dependent. My income is not dependent on you buying Medicare supplemental insurance. I want to get that out of the way. I actually am going to let my license expire because I don't need it. I'm not a insurance salesperson. But what I learned in my experience was that the supplemental insurance is probably the best thing you can get, and we'll do some comparisons here, and you'll see why. Part A, I call that automatic because it is automatic at age 65. Whether you want it or not, you're going to get it. Part B, you have to buy it. There's Part B is buy premium. There's a premium involved, and I get into those details here, but just remember, B is buy. You have to buy it. So you have a choice when that starts. Part C, or they call it the Advantage plans. You see commercials about it and stuff. It's usually Part A and B with some of them have D in there. But I call Part C caution, because you'll see in the trainings why I give it that label, because this is where I see a lot of people get into an Advantage plan, because a lot of them are free. There's no cost. That sounds great while you're healthy, but when you become unhealthy, you'll see why it's not so great. And Part D stands for drugs. That's pretty easy, right? Okay, let's get going here. Basically, health insurance everything out there that's worthwhile, they make it really confusing. So you have to have an expert to go over it with you. I just believe that the attorneys use big words and words that are confusing and throw in extra paragraphs, and the more they put in there, the harder it is to understand the contract. I think politicians do it too. You know, the more there is in something, the harder it is for you to figure out what you're really getting. But it's crazy. But just keep this in mind. You've got two choices. You've got Medicare Part A and Part B, and the variables that you can add are supplemental insurance and a drug plan, your Part D. Or you get an Advantage plan. The Advantage plan basically replaces Part A and Part B. And the Advantage plans are privately owned health plans by the company, by companies. So you could go to Mutual Omaha, AARP, just to name a few. There's a whole bunch out there that'll, and basically what happens is the premiums that go to Part A and Part B are now redirected to the company that you choose. And so you're redirecting your money over to them. And so that's why they can do it for free, because it's not really free. Nothing's free. And a lot of them have a drug plan, depending. And each plan is different. So we don't get deep into the Advantage plans because they're all different. You have to research them. You have to figure that out. And as I say, they're Part C, caution. The short time that I did work with the health insurance agents, the thing I learned the most is the policies you can't get when you really need them are the ones that you should be choosing. That's the whole reason I said earlier about this training. The nice thing is about the whole setup is at 65, you can pick a plan and you can't be denied. So if you have health issues, you can go and get a supplemental plan. It may cost you a little bit more, but you'll see the numbers in a little bit that it's going to cost you a lot less than if you were on an Advantage plan or other plans. And I'm telling you, every client I've worked with that's over 65 that already had a plan wish they could switch. And things you need to know, you have to make these choices before, start looking at this when you're 64. Like I said, you can't be denied. But if you don't make your choices at the time, like even for your prescription plan, if you don't choose one and later on you decide to get it, there's a penalty. It sucks. Everywhere you turn, they're going to hit you with a penalty. And I'll show you how the supplement plans can save you thousands of dollars. Okay? And those are the costs that go into all these insurances, and that's covered too here. And I provided you with some links. Basically Medicare.gov, easy to follow, but I took this out of the publication. The first thing you need to know, it's in print. And I love it because, they are they're trying to protect you by letting you know that your costs are going to go up every year. So this is another unknown in our lives. And I think in one of my other trainings, I talked about free healthcare. Nothing's free. And I told you what can happen because of free healthcare. And, a lot of you are really surprised. And, it's not as simple as you think. And here's a list of things that Medicare doesn't cover. And it's basically the same things that your current health plan, if you currently have a health plan, same things they don't cover. So, dental care, you have to look into your own dental plan. There's, and there you can get these, and we don't really go into these because these plans change every year. Every year, all these and these other plans here, the supplemental one, cost for long term goes up. Custodial care, these we cover because these are huge costs. And as I said in one of the trainings, 70% of us will need these. That's 7 out of 10 people in the U.S. will need custodial and long-term care. Okay, so just keep in mind you're not going to get anything more than what you're getting now when you get Medicare. It should be. I think when you retire, this is my belief. I think that's when healthcare should be given to the elderly. Take care of them. They did their, they put in their time. Open enrollment periods. This is what you can't miss, and it's real easy to miss. And it's it's the only time you could choose a plan, and it comes at the worst time of the year, October. What starts in October? Holidays, right? After October 15th, you have your Halloweens, Thanksgivings, everything happens, Christmas and your Hanukkahs, everything happens during these months. But that's when they choose to do open enrollment, which is when you can choose a plan. The only time you can't get denied is when you're 65 or if you continue to work. But that can change too. So you really need to talk to an advisor. And once again, you do get penalties if you don't make the right choices at that time. In that book, Medicare.gov, they'll probably mail it to you, but I want you to know that they have all these 800 numbers you can call to get help. And just keep in mind, though, the people who are working there are only going to answer your questions. I find that's a common theme within most advisors nowadays is they only answer the question you ask. And it's twofold. Number one, I believe the reason they do that is they don't want to overwhelm you with too much information. I have that problem. I overwhelm people all the time with too much information. And it's been hard for me to do these trainings because I have to restrict how much I tell you at one time. That's why we have different level trainings. So you can absorb and do the basic easy stuff before you get into anything advanced, which that's where I learned that a lot of people, when they get into the advanced stuff. So when you call these numbers to get advice, they're going to answer your questions, and most of them will not go outside of that and tell you, but you can do this. They're not. I think they even have a recording that says we're not allowed to give you advice. So they're only there to answer your questions. Okay, if you want advice, find a good advisor. Watch our videos on picking a good advisor. If you're turning 65, you got to start looking at your options at 64 because the door closes in 3 months, and you have some enrollments or choices you have to make fall around your birthday. There's a 7-day window around your birthday, so you need to know those things. I think I provide you with some links. So, educate yourself, know what you're talking about, and you're doing that now watching this video. But read some of the things on the links that I've sent you before you find and get a good advisor. That's not gonna, you see my captive versus non-captive advisors. A captive advisor is going to sell you what they have in their store, and And the thing with supplement plans is they're, well, I'm getting ahead of myself. They're all the same. Uh, so the special enrollment period is if you're still working. Then you could get in without being denied. I saw a video where this gentleman had a client who didn't retire till she was 84. She loved her job, so yeah, she was able to make her choices at 84. Military TRICARE. My father has this. He put in 20 some years into the military, but he still had to enroll in Part A and Part B. Okay, and he had to do that before he retired, because that's just how they structured the coverage. And what Medicare doesn't pay, TRICARE does. Here's a link. What's important to remember also, I should have put also in there, is who pays first. Because if when you get older, you may be, you may still have a group plan. Some companies used to provide you with health care after you retire too. Okay, and does your supplement plan pay? Actually, Medicare pays first most of the time. And then what happens if you're low income, which is Medicaid? Okay, and here's the link for signing up and changing your plans. I put it in the slide for people on the blog that you can get to it. Part A costs. You have your premium. Okay, and your premiums are taken out of your Social Security check. Yeah. So they get their money right back. So they deduct that from the amount that you're being paid. So you're looking, yeah. If you have a $1,200 Social Security, their calculation, they'll show you that they're taking out your Part A premium. But you also have a deductible, and for 2017, these are 2017 numbers, and co-pays and everything, because this is a government plan, so it can change. They can vote to change it. Whoever's running it can make changes. They have the ability to do that. Deductibles go up. It's for 2017, it's up to 1,316. Your copay, up to 30 days, and I'll run some numbers for you so you can see how that works. 61 to 90 days on copays, $329 a day. Okay, this is why a lot of people go with the Advantage plan, because it covers a lot of this stuff, but it doesn't cover as much. And once again, I don't get into those because it's there's so many different Advantage plans out there, and what they do. Coinsurance is zero, but remember, Part A is hospital. Okay, and I if you're part of my training, you'll get some links on the website. Okay, Part A is hospital. So if you're in the hospital for less than 60 days, what you'll end up paying is 1,316. That's your deductible. So you have to pay that amount. Everybody should know that. And some of you are watching this might be not even working yet, and not even thinking about retirement, but this is what you'll pay. But this is a good exercise if you're watching it. That's good. If you're in there for 50 days, which is less than the 60, you pay 0 here. You can see that right here. All right. Okay. Moving right along. Oh, thank you. But over 60 days, let's say 75, I kind of split down the middle here. Your copay would cost you almost $5,000. So you add that to your deductible, you're ending up paying over $6,251. Okay, for if you're in the hospital for 75 days. And these costs don't include your other costs. 120 days. Now I don't have to go over all the numbers here because now you know what I'm talking about. You're at almost 31,000 for 120 days. That's 4 months. You know anybody who's been in the hospital for 4 months? Yeah, it's expensive. This is 6 months. So if you were to get in an accident and end up in the hospital for 6 months, I've known people who have been in the hospital for 6 months after getting hit by a drunk driver. I know people who have been in the hospital for 6 months after surgery. Something went wrong with his surgery. I had a good friend of mine who was in a coma for 2 months. And look at the costs that are involved with that if you had just your Medicare Part A and not a other plan. $92,000. Okay. All right. So that's why I provide those numbers is so you can see that. Part B costs, your premium. There's a premium. So they base your premium off for 2017, they would look at your 2015 returns. Okay, 2 years prior. Okay, so that's a good thing to remember. We'll remind you, 2 years you want your income to be low, 85,000 or less, because look what your premium is here. That comes out of your Social Security check. Okay, same here. Hopefully you're being paid. If you're in this income bracket, hopefully you've been paying into your Social Security at that level too. So your Social Security will be maximized, which is about 3,000. Not a whole lot per month. So 36,000 per year. You're looking at covering that. Okay, pretty simple. Tidbit. 2 years prior to your retirement, don't make any money. Anyways, just kidding. That's just something to know. Okay, here's the Advantage plan. There, I provided a link there. These are actually links out of the Medicare website. That you can go to this Medicare website and look up Advantage plans, and you will see this exact. This is my source here where I got this from, and the cost. Like I said earlier, it's a private company, and they take you off of Part A, and they can change it every year, and they're different from each company to the next. So we will not get into this. It's just too much to cover. That's something you'll have to research on your own, but you'll know. I mean, do it. Check into it, and you'll see why I recommend supplemental insurance. Even if if you think if you're healthy as a bull, it's the unknown that you have to plan for. And it's your choice. I just want to educate you so you can make a better choice. I'm not telling you what to do here. That's not what we're about. We're about you picking your own path, but knowing which way to go. It might be rougher going one way or the other. Okay, here's Part D, prescription drugs. This is kind of cool because the thing about Part D plans, which you can get, there's a cost to them. And on top of that, there's a deductible. So you have a premium, and you pay your premium, and usually the higher your premium, the lower your deductible. So how that works out in math, and they change. So I am not going to get into the math on Part Ds. There's calculators on a lot of websites that are updated every year because it changes every year, and your coverage resets every year. So it's a vicious circle here, you'll see. But basically, you start out at a 75-25 coinsurance. Okay, you pay your deductible, whatever it is, and then you're responsible for 25% of those drugs. And you've seen on TV, some prescriptions can cost you up to $500, $1,000, $2,000. 25% of $1,000 is $250. And what is that, 30-day supply? So every month you have to pay that. Well, the nice thing is after total spent, where total spent is not just your amount, but the entire amount. So once you've have paid for almost $3,000 in prescription drugs, you and the insurance company, then you go into catastrophic. So, or you go into donut after you hit that and your coverage changes. Your donut hole coverage changes. And then once you spend $4,700 or more, which a lot of people do, I've seen people who spend $9,000. It's crazy how much they spend on prescription drugs in a year. Yeah, we're talking year to year, but it resets. So you have to understand that every year it resets, and they can make changes. So the big question is, do you really need it? And because the premiums are usually high, and they're not standardized at all. So once again, like the Advantage plans, you got to shop. But you ask yourself the question, like myself, I have been blessed not to have to take. I took prescription drugs as a child up to my 30s, so half my life was spent on a lot of prescription drugs to keep me alive, asthma and other medical issues, which through diet and exercise and getting older, I guess things changed. But I think it was diet and exercise that I'm no longer. I had asthma when I was a child, and not anymore. So I don't have to take all those things. And if you have children who have asthma, you understand. I spent a lot of time in the hospitals. It was pretty bad, especially back then, because 40, 50 years ago, they didn't have the same drugs that they have nowadays. Okay, but they can run the calculations for you here. You can go to an advisor, and usually if they do health, if they have a health license, they'll have a calculator. They can look at your medications and compare different drug plans for you to find which one will cover, because that's another thing. They cover the same drug at different rates. It's crazy. It's real complicated. It's so complicated, even the experts get confused. Okay, page 101 of your Medicare booklet. This is the 2016 one. This can change too. But basically, you see A through, and a lot of letters are gone because they got rid of those plans. But these are the supplement plans, and they are standardized. So what that says is no matter what company you go to, if you go to Mutual of Omaha, they will charge you, and I'm just giving you an example, $134 for a supplement plan. G, under the G. And then you could go to Company X, which will charge you $170 for a G supplement plan. You are the same person. You are a non-smoker or you are a smoker. You get the same coverage. So basically what I'm saying is, if you're getting a G plan or an N plan, or whichever plan you're getting, from one company to the next, compare price, because it's the same coverage. Exactly the same, because they're standardized. Okay? I'm going to cover just three of the plans because these are the best. There's some people would argue there's a C plan or whatever. Do the math and have an expert do it. But Plan F, and the reason I talk about Plan F is everybody looks at it and goes, it's 100% coverage. Yeah, but your premium, because Plan G covers 100% except for the deductible. So Plan G, you pay the deductible only if you use it. So if you're healthy and you don't use it, you're paying a lower premium. And if you do use it, you just pay the deductible, which is probably with your payments and the deductible are going to be less than what you pay as a premium for Plan F. And Plan N is another thing where you have to do some analysis because excess charges are not covered on Plan N. Okay? Plus you have copays for ER visits and appointments, which is $20. If the cost of a Plan N is less than a Plan G, you don't go to the ER a lot, hopefully. Some do. You don't have a lot of doctor's appointments. Plan N might be perfect for me because, I don't end up in the emergency room. I don't remember the last time I did, and I don't want to experience it again. I did that a lot as a younger guy. I worked in the hospital, and I used to go back and visit them all the time in the emergency room on a backboard. It's like, thank God I had 100% coverage back then. And excess charges, though, let me get down to that. Where doctors accept Medicare assignment, it's going to be zero. So this doesn't matter unless they don't accept Medicare assignment, which a majority of them do, but don't pick the one who doesn't and have this plan, because then you're going to be paying out on top of your deductible and your copays. So it comes down to what premium you can get. Shop around. Okay, next slide. There we go. So if your supplemental insurance costs you $1,680 a year, it beats not having it at all, since these are just Part A costs, and you probably have Part B costs on top of it, right? Think about that. Part B is visiting the doctor, right? And those can add up. And if you don't have a supplement plan, you're paying 20% of your costs. So here's the time spent. This is just for the hospital part. If you compare the Part A, you're looking at your deductible is covered by a supplement plan. It almost is even. The insurance company makes a little bit more. So, oh well, they got to stay in business. And if you're over 65 right now and you're still healthy, you may still be able to get a supplement plan. I mean, I'm telling you, it's like gambling. You don't know. You just don't know. But supplement plans are pretty good. That's, I'm pushing them because, once again, I did the math. Just to review things, you've got the two choices: Medicare Part A and Part B, and that's with you could pay for additional coverage. So with Medicare Part A and Part B, there's the supplement plans. Advantage plans, Part C, one or the other. You have to pick one or the other. You got two choices. And some of the Advantage plans, you might have to get a drug plan. Some of them you might. That's something you have to figure out. Your Part B premium is based on your income 2 years. Remember that, okay? That's that tidbit. And don't miss your enrollment periods. There's penalties. They're gonna get you. And the supplement plans, they're standardized. Don't get ripped off by a captive agent selling you a product at 170 when you can go to another company and get it for 130. That's $40 a month. That's almost $500 a year. You're giving away because you didn't do your homework. You didn't shop around. You got to shop around. That's what this is saying. Shop around, find the lowest rates. I mean, if I worked with a group that's their whole goal is finding the lowest rates, and I think it came down to Mutual Omaha and actually AARP, which I was surprised. A lot of people badmouth AARP, and I haven't found out why yet, but you could get one or the other depending on your situation, and that's what the experts will do for you. And at Part D, if you have health issues, you're probably going to need one if you're taking, I used to be not a paramedic, an EMT, and one of the things is usually people who are unhealthy are on 6, 7 different pills. There are quite a bit of pills sitting on their table there, and when we come to pick them up and take them to their emergency room. Okay, I'm going to thank you. Hopefully that wasn't too bad. And like I said, I'm probably going to, I'm going to post this on my blog because there's people out there that may not be part of the training that need to know this stuff. And if I put it on the blog, you could tell them to go to the website, familyinvestor.net, and go to the blog. Okay, thank you very much. All right.